I was 16 and I was trying to score a touchdown, and a bunch of people's face masks kind of hit my shin, and it was just a bruise there. And then we were maxing out one day, and I squatted down, and it felt like my leg just snapped in half. And I was diagnosed with a rare type of bone cancer.
It was on Thanksgiving Day that I woke from surgery and I saw my parents weeping at my bedside. It was cancer. I thought, how in the world am I going to pay for this? I have no health insurance.
I was diagnosed with breast cancer when I was 25. I was at risk of losing fertility, and none of those needs were ever brought up by my physician.
The first surgery I had was 14 hours, and it took 10 inches of my tibia out and replaced it with a cadaver bone, and then a foot-long titanium rod, and they put screws just below my knee and right above my ankle. But I just had my 42nd surgery trying to repair my leg from the first surgery that I had.
So now I had chemo and no hospital facility would treat me. I asked my doctor, what can we do? And he said, I am so sorry. There's just nothing I could do. I helped you this far. Good luck, Godspeed. And thankfully, my parents let me move in. They ended up taking a second mortgage on their house.
You know, we did a lot of research. We always brought questions, and no one counseled me as far as the chemotherapy went. These are your options. It was more of a thing like, well, here's the information. You know, just let us know what you want to do.
I think I've ranged from at least 10 to 20 doctors from different fields and specialties. And that was a real struggle in the beginning to get everyone on the same page. But I think their enthusiasm and persistence of making sure I'm always up to date on everything I needed to know kind of waned a bit. I said it's a good time for the patient to start taking it upon themselves to start, doing what they need to do, but I kind of tuned everything out and fell off on that part a little bit. I feel like every few months I'm having to sign some new insurance policy.
I did get a lot of discrimination, people thinking that I was this low-life person or whatever, or getting this free health care, freeloader, things like that. There was one point where the county facility refused to pay for my Neupogen shots. They wanted me to administer them myself.
A few surgeons saw a lot of stuff from my perspective and always asked my opinion on what I wanted to do next, and they always thought about years down the line and my quality of life after all of this, and some were just, we're gonna cut your leg off.
I think patients need to do research and ask questions, know what the process is.
Definitely a new model would be great for the healthcare system. I've been 5 years off treatment now and 5 years cancer-free. I'm not getting chemo anymore, but I'm still getting the major surgeries as if I was, trying to save my life, but they're just trying to save my leg.
Patients need to feel comfortable talking to their doctor. I mean, they're humans. We kind of put them on a pedestal, but it's a partnership. It's not this, I'm telling you to do this. It needs to be a relationship.